Okay, sorry about that. I keep forgetting to delete extra videos and then it shuts off on me prematurely. Anyways, as I was saying, neurological and physical complications can result if tick bites are not treated almost immediately. And it is best to avoid places where ticks are found, such as highly wooded areas. And if you are going to be where there are ticks, make sure you wear long pants, possibly boots, long sleeves, cover up your neck, all the different areas that are exposed if you possibly can. It's hard when it's hot out. You don't want to wear all that heavy stuff. So, unless you have to work in the woods, I suggest you avoid them if you don't want tick bites. Also, make sure your animals are treated for ticks and fleas and things like that because they do carry disease. Obviously, a lot of that stuff is kind of already well known. So let's move on. The early localized symptoms, especially the physical ones, of Lyme disease are headache, flu like symptoms, fevers, chills, real bad headaches. This can occur from days to weeks after a person is bitten by a tick. The next stage is called the early disseminated physical stage. This can happen weeks to months after someone is bit. What happens in this stage is that there is a circular rash that's seen, and sometimes I think this rash can be seen right away, but I do know that after days to weeks after being bitten, and there goes that airplane overhead, so I may have to wait till it passes or you won't be able to hear me. Okay. Weeks to months after a person is bit, there's a circular rash that is seen on the skin. Sometimes these rashes can travel and produce other rashes. Sometimes there is thinning of the skin on the hands and even the feet. Earlobes can get swollen. Nipples on a person can swell. It causes pain and redness. There is often swelling of joints. It can even cause nervous system damage and problems such as pain and weakness in your arms and your legs due to inflamed nerves. Heart problems like a slow heartbeat are very rare unless you already had a weak heart before the tick bite. Late persistent stages of Lyme disease are the most serious stages, and this happens weeks, months, and even years after a person is bit. There can be symptoms of arthritis, nervous system issues, numbness in the arms and the legs, fatigue, vision and hearing problems, and as I said earlier, bad headaches. Now, those are some of the physical symptoms, but you might not know about the cognitive issues that can happen with Lyme disease from a tick bite. Cognitive issues such as memory problems, the trouble with thinking your thoughts, having a stiff neck from swelling of the brain and spinal cord can cause a lot of these cognitive impairments and also pain and discomfort. If a person is not treated with antibiotics, 5% of the people that were not treated may experience pain that is sharp and shooting, and it goes in the hands and the feet. They might have numbness, weakness, and tingling in their body. Other symptoms could be neurological symptoms, such as problems with thinking, as we said, remembering things clearly, recall, staying focused, having vision problems. Facial paralysis is another thing that can happen with a tick bite. As the Lyme disease progresses, a person can become disoriented, dizzy, experience confusion. They might have trouble talking with people and putting their words together in conversations. Physically, they can become very extremely weak in their muscles. They could have seizures, and they can have changes in their personality. So, this is kind of a brief video, and I have somebody that's soon going to share the story of what they've been through with Lyme disease and what they live with every day and how it affects them. Some of these cognitive and neurological things are how my one friend is feeling right now and the things that he's going through. The confusion, the mixed up thought patterns, trouble focusing, and all that kind of stuff is what he's dealing with. and he is about to be treated with high course antibiotics, and hopefully will be feeling a lot better soon. I don't know if tick disease, or Lyme disease, sorry, ever truly goes completely away, but I do know that people can feel a lot better with antibiotic treatment, but it is a long process and it needs to be caught as soon as possible. So if you've been bit by a tick, don't brush it off like it's nothing. Please go to the doctor, get looked at, checked out, examined, and let them decide what to do from there. It's not something to play with if you've been bitten by a tick. It can definitely cause you some very bad problems. Anyways, I just felt this was a discussion that needed to be had on video in case you know of anybody that is suffering from Lyme disease. They may seem like something more is wrong with them, like they have another disorder, because it mimics a lot of other disorders. For instance, some people may be seen as bipolar or schizophrenic or any other personality type altering disorders, because tick disease, or Lyme disease, I keep saying tick disease, but Lyme disease can make you, it can alter your personality, it can alter your character because of the way it makes the brain swell and affects different parts of the brain. So it's something to remember. If you do know anybody that has this problem, I hope that you would suggest they're getting help with antibiotics and from a doctor. If you know of anybody that you're not sure of their behaviors because they've had Lyme disease, be kind to them. They can't help the fact that they can't stay focused and that they can't have a normal conversation. It's not their fault. It's really the Lyme disease affecting their brain. So anyways, I just wanted to say all that to let you know that, once again, I'm covering a topic that needs to be covered, and I want people to know that I care. So God bless you, and thanks for watching. I hope that explains a little bit more about Lyme disease.